Well, so the prospective clinical study is one of the important parts of the METASTRA project to see if what we are actually working on, if it's going to help us. The people that I talk to, both clinicians but even patients, they are really anxious to know what is their end result, because there is something needed that is not yet in clinical practice. And what we need is better predict who needs treatment and who doesn't need treatment. So we don't want to overtreat, we don't want to undertreat. And that's what the feedback, what I get back a lot of times from many sources. I think the DSS is going to be a great tool in the end, but it's going to take some time, but it will be hopefully mainly directed at the people that are not spine experts. For me, I don't think I'm going to use the tool because I see these patients all the time, and for me it's relatively easy to find the pattern and know what to do with these patients. But typically for a lot of physicians that are taking care of these patients who are not experts in this field, it's good to have a tool to give them guidance. Typically saying, okay, this is a patient you should probably either treat surgically or not surgically, and help them out to give a direction what would be the next step in the treatment process. That's an easy question for me, because the most pressing issue is making sure that you find the patient in time. If you have time for these patients and they don't present like emergency cases, you can actually do something really useful for them. And that is because you still have time for a good workup, a good planning. It's relatively easy to come up with a plan that is actually beneficial for them. So the pressing issue is make sure you find them in time. And therefore we need the help not only of the experts, because they are typically in the last part of the treatment chain, but also in the people, the physicians, before the definitive treatment goes on. So in the whole treatment chain, I hope that we can find and educate the care providers that are before the final treatment and let them also know what's on our minds today. For me, it's important to make sure that we find a method to engage the healthcare providers that see these patients all the time. So what this project in the end can deliver is a product that can help them in their daily practice, evaluate their patients and make informed decisions. And they're helped by a tool that has been developed by experts based on a lot of experience and also a lot of scientific and rigorous data that's been collected and processed right now. And I think this project will in the end come up with a relatively simple solution to work with, but there have been a lot of thought in this project before it will get into your hands.